Thank you, Beatrix. Thank you very much for presenting me with all the superpowers. But so just a little bit about myself on top of what Beatrix said, and so I'm doing now a PhD in innovation and exploitation of research. So how to take what we do in our papers out on the market. But I arrived there by 15 years working in two governments, Romanian and Scottish government, businesses, software development companies to bring their products to the market in the health tech area, working in clusters, working with universities in Spain and Norway, working in Brussels, having a scholarship in Belgium and so on. So then I seen a lot of technologies that have been developed or could have been developed if there would have been one more step. That could be finance, that could be better communication, that could be novelty, technology, something that was missing, a patient more in, patient more out, so on. So now I'm standing here in front of you, almost closing all the talks. There will be some on Friday also. But I want to talk with you about the innovation thinking, because we heard all this, the 2.5 days, we heard a lot about the journey that we have in the Mobilise project. We heard about the challenges in the DARE project. We heard about the technology use. What else? Citizens, legal issues, certifications, so on. But we still need to keep positive thinking. We still need to dare and dream big. So hence my title. So I want to talk with you about two things. One is the mission-oriented innovation, and that's not necessarily my thinking. It comes from somebody else, and I'll just say, and then a little bit about the group work that we're going to have after the break. But before that, also one of the speakers yesterday asked you what's innovation and technology advancement. I just want to make a little bit clear or put into your brain map what is innovation and where it comes from. So it comes from Latin, so thank you Italy, or thank you Manchester. It comes from the word renew or change. And then it was developed like a process that renews something that exists or brings something new or change the market or to a new market. But sometimes we find also the word invention and we don't know where to put it next to the innovation. It is the invention, it is the direction creation of the innovation. And then we have also improvement, because we also hear about improvement. It's improvement and innovation, it's innovation and improvement, and so on. So the improvement is doing something better, but it's not disruptive. One of the speakers today showed us the candle and then the bulb. So that was a huge leap, huge change. If the candle would have been pink, then it have been an improvement, but it was a completely change, and then it also changed the market where it was used. So I said about mission-oriented innovation, and this comes from Mariana Mazzucato, the one that also helped in develop the frameworks, a couple of frameworks and policies at the European Commission, some of the funding, that I forgot to say that I worked for many years in grants and funding. So then from there, reading a lot about policies at the European Union, and not only European Union, because policies of the European Union, then they go to the policies in the states of the states part of the European Union and also outside. I was like, okay, we can think of us as going towards a mission. And I'm going to talk a little bit later about this mission. So when you think also of your work in the afternoon, think about how you involve the research that you do and you combine with the technologies. We've seen some technologies these days. you know about the technologies, you use technologies in your lab. So think about these two combinations. So also in this thinking of you solve something greater, so a mission, you have a mission to save the world, to develop a new treatment for Parkinson, to develop a new method for monitoring patients and so on. So how do you achieve it? What's the problem? What's the need? It's your problem? It's somebody else's problem? How do you frame that? Take risks, because we also talked about trials, try and fail, so take risks, that's very important. Sometimes the founder, maybe sometimes the universities or companies, they don't like to take risks. But you need to find the ways for you to test and go more than just stay safe in your little development or in your little lab. We talked also about multidisciplinarity. So you can consider one risk going out of your field and start talking with the other colleagues from other areas. That could be a risk for somebody that doesn't like to share their work, but that brings you different perspectives. Just one example. Yes, be ready to change, to adapt to the new information and circumstances. We had some examples from the COVID. We talked about on Monday, I think Lynn presented on the Mobilise project that we had from COVID to earthquakes next to the manufacturer where they were doing the sensors, to strikes and so on and so forth. So circumstances can change. And also the technology. Today we have one technology. In 3 months, that can become absolute. So Melissa was saying about the Up and Go that they cannot put it in all the technologies, in all the phones that are there, because they change super fast. So you need to be aware of this and adapt and make a system that adapts. And yeah, multidisciplinary, I already mentioned this. So I think we all know this. So this was the thinking of the mission innovation. So why? Because this was everything. Was research, was innovation, was invention, was improvement. And I want to show you some of the, I don't know if you have seen this. I hope you see it quite okay. How many technologies we have due to mission Apollo. You find this on this website so you can see it better on the NASA. I just want to give you some examples that we are using every day. This guy here, the mouse, it came from there. They needed to control the computers faster, easier. And they developed for the mission, but it was a work. It didn't look like that. Now it looks like that. The CAT scans, we wouldn't have had it if they wouldn't have needed technologies to have clear pictures while following the mission. What have LED? The same, they needed different type of lights at that point, and so on. So think about yourself that you want to solve something bigger, and look around, because there will be people or other initiatives or other groups that will help towards this. And I come back to this, what Beatrice presented on Monday, because we are working, or we could think that we are working for the Sustainable Development Goal 3, better health, good health, and well-being. But while doing that, we are touching in all the others, or if one goes and unbalanced, then everything gets unbalanced. So we all, the society, the research, and the innovation nowadays, it's looking around, okay, how we can solve the problem under an umbrella, under a mission, under something that creates impact also. So I was saying that bit of my talk is also related with your work that you're going to do in the afternoon. So then think about what you're going to do, that you're part of a bigger solution. We gave you 3 areas: prevention, monitoring, and personalized healthcare. We already kind of put it on an umbrella on you. So what are the problems, the challenges, and the needs in the society? Why do you go on your solution? Set a goal. Some of you already did this before. Solutions are funded by people, and you find them around people. So Sinead talked also about how to communicate this and everything. So it's very important. And fire your imagination. Just go for it and use the creativity. As a reminder, we ask you to think about these 4 I's: innovation, impact, implementation, and I. All of them are very important. How you present them, which is the order, it's up to you. They have to come in an elevator pitch, what Sinead said. They don't have to come for me or for the jury on Friday, but it's an exercise for you for the future to see how you can capture, how you can bring your ideas in front of the others. And to detail a little bit more on this, you can think of parts of this. All of these, they answer the 4 I's. So you have the problem statement. So what's the problem? What's the challenge? The challenge is the 3 big areas we already gave that one. What is the need and the gap that you are going to fill? Is there somebody there already? What do you bring more? That means other solutions. What's your product? What's your solution? So present us what do you sell? Whatever it is. It's a research, it's a paper, it's what? What's the innovation? And what's the competitive advantages? Why you and not you? Why me and not Beatrix? Why not Martin? So tell me, why should I choose you? Why should I buy you? When I go and buy a gadget, a wristband to follow my steps, why do I buy one and not the other? And pathways to the market, that's also important, because if you tell me why should I buy you, then I buy you. And you can develop further your product or not. You can just sell your company or whatever. And stakeholder is also important, because that comes thinking of why and to whom to sell. And also, Jer mentioned about the budget and resource. So I hope you listen, that you can save some money with some technology, and you can also add more features by saving some money, because then you have money or time, or depends what you need into that one. And the impact, I already said, think about the future. And all the speakers before me, they kind of guide you towards the future, where we want to be, what we want to be, how we want to arrive to the patients and the citizens. And now, what's left? Just to jump in your creative and innovation booth and start on the projects. And I'll give the word to Jane to present you a little bit what is to be done after we finish the presentations, and also in the afternoon, and what do we expect from you on Thursday and a little bit on Friday. Okay, thank you very much. I'm here if you have any questions for me.